Our first guest here in the Marion Knott studios at Chapman University is Dr. Michael Krychman. He is one of only 5 doctors in the United States who specializes in sexual medicine, and the only doctor with such expertise in Southern California. In Newport Beach, Dr. Krychman is the medical director of sexual medicine at Hoag Hospital. He's also the executive director of the Southern California Center for Sexual Health and Survivorship Medicine. Welcome, Dr. Krychman. Michael, thanks for coming. This is a great topic. I heard you speak several months ago, and you talked about this, and I was shocked. I've been in practice many years, and I don't remember, except maybe 1 or 2 women, a couple of decades, who mentioned anything about sexual dysfunction. Yet, every day, 1 or 2 men in my practice will mention something about sexual dysfunction. So I was blown away, to put it mildly, that this is such a big problem. And when you think about it, it is. It affects, I guess, the woman, the man, and maybe the whole family. So it's really a great service that you're providing, and really looks like a really needed service. So I wonder if you can tell me a couple of things that I don't understand is, what is survivorship medicine? What does that mean exactly?
Well, Larry, thank you so much for having me here today, and you bring up some really good points. I think one of the important things to remember is that female sexual health is a huge issue. About 40 to 50% of all women of all ages have some form of sexual complaint. And the big problem is people don't want to talk about it. It's a really private, intimate issue. Doctors, unfortunately, are not well trained in medical school to address the issues, and patients kind of feel uncomfortable about it. The whole field of sexual medicine is really evolving really rapidly, and Viagra really brought sexual health concerns to the forefront. In terms of survivorship medicine, when people think of survivorship medicine, most people will think about cancer and how cancer can impact a person, and living with a disease can impact both their general health and their relationships. I think the big issue to remember is that when we talk about survivorship medicine, people are living longer, healthier lives, but they have a chronic disease, whether it's hypertension, diabetes, heart disease, or arthritis. All these diseases that we are treating and diagnosing for patients, they all impact quality of life and relationships as well. So when people come to see me in terms of survivorship, not only do we address cancer, but we also address the whole global concept of chronic disease and its impact on relationships and your overall quality of life.
So the age groups are just those in the 40s to 60s, or what kind of age groups are you seeing here for your problems?
Well, it's interesting because we're seeing people from 18, and just last week we saw a lady of 86 who came into the office for some help and evaluation. So I think that's also another myth that we need to dispel, is that sexuality, intimacy, and very active lives are really only for the young at heart. It's not true. It's for all ages, and everybody of all ages can benefit from the services we offer at the center.
Yeah. Tell me, can a patient's hormone levels be normal, and can they still experience some sort of sexual dysfunction?
Well, Heidi, you make a really good point. I think it's important to understand that women are very complicated, and hormones is only one very small piece of the puzzle.
My husband says that too.
You're right. So, certainly hormones have an important part, but I always say they're not the be-all and end-all. So there's a variety of different factors that influence sexual function. I have a lot of women in the center that have normal or even above normal hormones, and they're not really doing very well in the bedroom. But on the flip side, I have people that have no hormones whatsoever, and they're having the best time of their lives. So it's really important to understand that it's a really complicated issue for women, that hormones are important, but they're not the be-all and end-all. There's a variety of other things that are going on within the person that impact your interest or your level of performance as well.
How much does the environment or day-to-day living impact sexual performance?
Well, that's important because I call that environmental sexuality. And I think as we learn more and more about relationships, and when we assess people, we understand that we like to think that men are really liberated, but unfortunately it's not always the case. Women are still the primary caregivers, they're still the cookers, the cleaners, they take care of the kids, they either work in the home or out of the home or both. And then when they come home, they tend to take care of the kids, check homework, bath time, cook, clean, get everything all ready, and then at 11 o'clock at night, they're expected to wave this magic wand and become this voluptuous seductress, and that's not always the case. People are exhausted. You know, more and more stress, more and more email demands, work demands, really kind of puts intimacy, connectedness, relationships on the back burner for a lot of couples.
For sure.
So that's how the environment, and we kind of, when we do an evaluation and an assessment of people in our center, we kind of look at the whole picture. So we kind of not only, as you said, hormones, but also see what else is going on. Is there job-related stress? Is there financial concerns? Because all of these are also very important parts of the whole picture.
So you have a multifactorial approach. There's not just one thing. You just don't look at hormones and send them out the door. You just don't give them psychological counseling and send them out the door. It's the whole gamut of things that you investigate.
Yeah, you're 100% right. It's not only about the physical. Sometimes it's, you know, chronic disease, whether it's diabetes or hypertension, and we've seen a lot of women come into the center to see that, and they're saying they're not feeling as well, there's no desire, no interest. We do check hormones. We check for thyroid. About 15 to 20% of women that come see me have underlying issues that are easily correctable. But other women, the hormones are normal, there's other things that are going on. So we kind of do a very holistic approach. And the holistic assessment really leads to a holistic treatment plan. So we have developed a lot of very interesting programs which include, you know, we use acupuncture. We have a great program with acupuncture and libido and menopause issues. We have a great program that looks at support services. So it's not everybody needs counseling. I think one of the big issues is for so long, you know, men, if they come in and they have issues related to erections or what have you, instantly the doctor thinks, okay, let's check their blood pressure and their cholesterol. It has to be linked to something physical.
Right.
Women, on the flip side, when they've gone to the doctor and kind of had the courage to say, I'm not interested, or sex isn't the way it was, the response that women were getting were, you know, go home and relax and take a hot bath and maybe a glass of wine would help.
Exactly.
But we're now coming full circle for women, understanding that there's underlying medical issues. So it's a combination of medical, psychological, environment, you know, a lot of things. Sometimes even stress with kids, you know, work-related can impact a relationship as well.
Let me ask you this: is there a Viagra for women now? I mean, are you working on something like that?
Well, there are, you know, there's a very big race right now with the pharmaceutical companies. There's a lot of things. Unfortunately, there's nothing in the United States right now that's FDA approved for the treatment.
But in Europe?
In Europe, there is actually a testosterone patch, but that's really, it works along the lines for low libido or low desire. But, you know, testosterone, androgens, that has been the mainstay very often. And, you know, I think it's important to understand that there's no such thing as a free lunch when you're using hormones. There's risks, there's benefits, and people really need to understand the concerns. There's other drug companies right now that are working on medications that will influence the global response in terms of the sexual response, whether it's desire, arousal, or other areas as well. You bring a good point about Viagra and how Viagra really changed the way we look at sexuality.
Yeah, really.
And I think that's a really important thing to remember. I always call it the Viagra/lawnmower effect. People take Viagra, they go out, and then they're back and ready. And I think it's important to remember that a lot of prescriptions of Viagra are not refilled. And the reasoning is because they haven't looked at the wife or the girlfriend. I think it's important to understand that it's a couple's issue. So we try to assess the whole couple, not just one person, but how the couple.
So you do couples, yeah.
We do the whole couple because things change. Sometimes it's about the communication, sometimes it's about misunderstanding, sometimes it's not addressed. So, and I think the information really supports the fact that when you address both partners, you tend to do much better in terms of treatment and success.
Exactly.
Let me ask you, in the younger woman, do birth control pills enhance sexual desire, or do they have a negative effect? What is the effect of birth control pills?
Well, birth control pills are really interesting because I think now that's probably one of the most hotly debated topics in terms of sexual medicine. There is a whole group of people that feel that birth control pills have really given people a lot of sexual liberation. They're not worried about being pregnant. They have other concerns, a lot of very good health benefits in terms of taking the birth control pill. But there's also a very interesting field of emerging medical research and data to support the fact that some women on birth control pills, about 15 to 20% of women on birth control pills do experience sexual pain. The tissues, the vaginal tissues can change, and it could really affect their sensitivity and their pain level. And we're seeing more and more women with a new medical condition called vulvodynia. It's really about pain in the genital area, and it's really very often closely linked to birth control use.
My goodness.
Wow, so you really treat the whole gamut, the whole thing, and people need to know about your kind of program, because this is a big, big problem in I imagine the whole world, especially, and in this country. And young women, they can have problems, and women in their 80s can have problems. And it's a holistic approach that really can get to the bottom of it. You just can't give them a pill and shove them out the door. You just can't give them one type of treatment and ignore the other portion. And you have to take care of their spouse too, I guess. Or
right. And I think you make a good point. And I think our approach is really, I say that women are not cookbooks. And I think the most important thing to remember is that you have to really individualize. And we spend at least an hour with you on your first visit, and we really get to know you about what your goals are and what you will accept in terms of treatment. So I know as a doctor I can write a prescription, and I have about a 50% chance of you filling that prescription. And even if you fill it, I then have about a 50% chance of you taking it and taking it correctly. So we at the center try to empower rather than prescribe. So I want my patients to kind of think of me when they're on the treadmill and understand the benefits of exercising, or think of me when they're at the grocery store and picking out and planning their meals, because there's data to support that food and nutrition and exercise, they all benefit you in terms of overall health, which influence sexual health as well.
Well, I think they're going to think of you after this discussion. This is fascinating. I mean, we really appreciate your coming. I've learned a lot today, and I'm sure our viewers are going to learn a lot.
Absolutely.
Well, thank you so much.
It's a great service, and thanks so much for coming.
Thanks so much.